In case of vector-borne diseases like dengue and malaria, what you normally see is a seasonal increase in the number of cases after rains or monsoons in different parts of the country. And this is basically to do with the vector and the availability of the breeding sites for the vector, which is caused by the accumulation of water following rains. Whenever you have excessive rains, there will be more breeding sites, especially if it is an intermittent sort of rainfall. And also, if there is more construction activity, you will have more places where water can accumulate. So in either situation, you will expect more breeding sites and more vectors. And since the virus is circulating, as the season arrives, there is more circulation of the virus through more vectors, and that's how you experience a seasonal rise. Infrastructure development has traditionally been a risk factor for the introduction and spread of vector-borne diseases. For example, the irrigation canals, when they entered into Rajasthan, that's when malaria got introduced into Rajasthan. So well, that is just one example, but in case of dengue specifically, the more the infrastructure development, the more the construction sites, you have these areas where water can get accumulated. So the control of dengue is not something which is rocket science. It's a known set of interventions which are available, and broadly speaking, it's a massive construction activity which is going on, which appears to be making more vectors and more viral activity being available. So the sooner we get rid of these breeding sites, and also knocking out the adult mosquitoes so that they are not available to bite and transmit the virus from one infected person to the other infected person. The most important thing is you have to reduce the source. So in terms of source reduction, you have to address the water bodies and the larval sort of propagation which is going on. Then the next stage in the disease is the mosquitoes, the adult mosquitoes. So there need to be fogging operations where you have to knock out the mosquitoes, especially in areas where you've come across a dengue patient has been reported. So those areas are around that area where the patients are reported. The fogging operations have to be done, because it is expected that the mosquito has bitten that person and is carrying the virus. Basically, as a prevention, we need to make sure that we need to be more receptive to the public health aspect of dengue prevention. By not allowing the inspectors inside your houses and not letting them check does not really help you, because you are not only endangering your case, you are also endangering the case of people around you. So we have to make sure, as public, we have to make sure that we don't allow water accumulation in and around the houses, whether it's the coolers or the pots or money plants or tires and things like that, overhead tanks. Specifically, since the vector of this particular disease is a day biter, it's important that when we are out in the office areas, in the schools, you should be wearing clothes which can cover the exposed parts of the body, full sleeves clothes, and kids not wearing skirts or shorts and covering those exposed parts of the body.